Now, it is said that almost everybody has a headache at some time. What's this headache about? Is it something sinister, or is it something we should just take with passing, something normal? Now, here with me to discuss headaches, this fairly common phenomenon, is Dr. Frank Ojini. He is a consultant neurologist from Lagos University Teaching Hospital, Idi-Araba. You're welcome to the show, sir.
Thank you. It's a pleasure to be here.
Now, to start off, is a headache the same thing as a headache disorder?
Yes, actually. Headache simply means head pain or pain arising from the head or felt in the head. Even though we tend to use the term headache disorders for the primary headaches, because headaches are divided into primary and secondary. So we use the term headache disorders for the primary headaches, but it's the same thing really, headache disorder. So
could you classify these headaches for us? What really are the primary headaches and secondary headaches?
Well, like I said, you have primary and secondary headaches. Now, the primary headaches are headaches where the problem is the headache itself. That is the illness, the headache. No underlying problem or illness, just the headache. While the secondary headaches are headaches that are like symptom of an underlying illness. Which the illness may be something in the brain, or it may be systemic, but rest of the body.
Now, we were told, is this true, that most headaches really are indications of something else, something underlying, like you said, most of those headaches? Is that true?
No, it's not. Most people who have a headache, like you said, headache is virtually universal. I must, however, say that not everybody has experienced a headache. There are some people who have never had a headache in their lives, but it's highly prevalent. Most people who have a headache will have one of the primary headaches, which is the tension type headache. Okay, that's the one people call the common or ordinary or normal headache. Okay, but it becomes a problem when it's frequent, or when it doesn't respond to the usual simple analgesics that people take. Then you now say that individual has a primary headache disorder, tension type headache type.
Okay, so if, for example, somebody doesn't get enough sleep, maybe goes to bed late, wakes up really early, and has a headache, would you call that a primary headache?
Yes, it's a primary headache.
Okay.
It's just precipitated by you're not sleeping well or not having adequate rest, yes. Because if you investigate, you're not going to find anything. So that's a primary headache, and it's usually the tension type.
Okay, so what are the most common headaches that occur?
Well, the primary headaches, tension type headache is by far the commonest. In fact, about 80% of women and less than that of men, about 60% of, 70% of women would experience a tension type headache. Usually it's infrequent, occurs in situations like what you just said, stress, not sleeping well, fatigue, things like that generally. So that's the commonest. Okay, and then this is followed by migraine headaches. Migraine is far less common than tension type headache. That is commoner in females than in males. I think the percentage will be about 20% in females, and
is there a
less
reason
than that in
why
males.
It's more in females?
Well, generally, on the whole, females tend to experience headaches more than males. Some people say it's because men don't complain when they have a headache. Others say, well, it might be due to the fact that women have so many reasons for having a headache, emotional, stress, domestic, and all that. But I don't think that's the case. It might be hormonal, actually, because there are some headaches that are related to hormone levels in the females.
Now, there's this common saying sometimes that people make. They say, oh, this child gives me a headache. Is that just a manner of speaking, or does this really happen?
No, I think it's a manner of speaking.
Okay.
No.
So what really, you started by telling me a bit of the headache burden.
Yep.
Can we go through that, complete that thought?
Okay. Well, I said that headache is, well, we know that headache is by far the most common health complaint, all right? And even conditions that, other conditions can cause a headache. So it doesn't happen to be something in the brain alone. Okay, you could have a fever, malaria, for example, and headache would be one of the symptoms. Typhoid, several things. Okay, so it's highly prevalent. But the problem is that it's not just the prevalence, it's actually more that a lot of people are suffering unduly from these headaches, thinking that, well, it's an ordinary headache, you shouldn't complain. You take an analgesic, a painkiller, it's still there, they still continue. But that shouldn't be, because headaches can be properly treated.
Okay, so let's know for the record now, when an individual has a headache, what's the first thing he's supposed to do? Well,
usually it's the common headache would respond to normal over-the-counter painkillers, analgesics, paracetamol, aspirin, or one of the what we call non-steroidal anti-inflammatory agents like ibuprofen, brufen. And that's all. You take it and the headache is relieved and you're all right. Although there are also things you could do too. You don't need to take medication. You could try that first. If you know that the headache is due to the fact that you haven't rested, simply rest.
Rest.
Yes. Massage helps. Some people talk about relaxation techniques.
Would that be like massage of the temples? Like
yes.
There was somebody on the screen, you know, she was holding the temples.
Yeah,
somehow.
you could do that. Yeah, because we know that some people with tension type headache, there's a contraction of the muscles of the scalp and back of the neck. Okay, these muscles are contracted, and that could be part of the cause.
Yeah, that's
of the
the
headache.
lady. She has her hands on her temples, like she's massaging, you know, the headache
right,
away.
Good. Yeah, it can help. Okay. Now, it's only when this headache is frequent and you need to be taking a painkiller 2 or 3 times, or not 3 days a week, then you know that that's a problem. Okay, and that's when you should see your doctor.
Okay. Now, but there's this type of headache I heard about, called a medication onset headache or something like that.
It's medication,
actually from taking medicines.
It's called medication overuse headache.
Overuse headache.
It's also called rebound headache or painkiller headache.
So where does one draw the line when it comes to taking medicines for headache?
Good. All right. The thing is, when you need to take medication frequently, painkillers frequently, you get to a point where the headache is now caused by the painkiller.
Okay.
All right. So that's why I said if you need to be taking medication 2 or 3 times a week for headache, then you are getting to that threshold.
Where you should go and see a doctor.
Yes. Because if you do that for months, then your headache will not be as a result of the medication, rather than the primary headache problem.
Itself.
And then it becomes difficult to treat, actually.
Now, sometimes when one goes to the hospital and complains, okay, I have a headache, you are asked what part of your head is the headache and how does it feel? What's the significance of this?
Okay, well, it's actually to try and decide the type of headache you have, because migraine headaches tend to be unilateral, one-sided. Okay, whereas tension type headache is generalized. You feel it all over the head. It's more like a pressure or a weight on the head, or as if there's a tightness around the head.
Okay, the one that feels like a band.
Like a band. That's the tension type headache. So if your headache is one-sided, when we start thinking of migraine, although it doesn't mean tension type cannot cause that. It can. The other thing is if you have a persistently unilateral headache that is on the same side all the time, that may be slightly worrisome. It might mean that you should be investigated. Could be something, an underlying problem like an aneurysm, or called a dilatation of the vessel and all that. Okay. Well, mostly also there are some headaches, primary headaches, that will cause unilateral headaches persistently on the same side, which is a third type of primary headache, which we haven't talked about, said anything about, which is called cluster headache.
Cluster headache, okay.
Yes.